Breaking down the latest coronavirus headlines. Joining us this morning is Dr. Ashish Jha, the Dean of the Brown University School of Public Health. Thank you so much for being with us. Let's start with this new variant of COVID-19 from the UK. Some British officials warning it could be up to 30% more deadly, but scientists are stressing more research is needed about that. Explain this to us. What does the science here actually tell us?
Yeah, so good morning, and thank you for having me on. Yeah, in terms of the UK variant, it is clearly more contagious. I don't think there's any question about that. The question that has come up in the last few days is it actually also more deadly if you get infected with it? There is some preliminary evidence that it may be. Alternatively, it could be that the variant hit the UK when their hospitals were overwhelmed, and we know when hospitals get overwhelmed, mortality rates tend to rise. So we have to sort out, is it the virus, is it the hospitals? That still needs to be sorted out, but it's clearly still a deadly disease and clearly more contagious.
So those numbers are not quite clear quite yet. So we're seeing multiple new variants now, not just the UK one. There's one from South Africa. There's some homegrown ones now as well. How concerning is this? Does it add urgency to step up the vaccine effort before this virus can make any more changes that we see?
Yeah, absolutely. I think it ups the urgency to get people vaccinated. Look, the best way to control these variants, the best way to stop new variants from coming out is to control the pandemic. And anything we can do to control the number of infections, every new infection is an opportunity for the virus to mutate further. And we've got to really try our best to control these things. And the vaccine is our best tool right now.
There are reports that the current vaccines aren't as effective against these new variants. And so I'm curious, at this point, can we tweak the vaccines to make them more effective? Is there something that we can do to tackle those new variants in a more strategic way?
Yeah, so all of the evidence right now says that the current vaccines work great certainly against the UK variant, against most likely all of the others. There is some question about whether the South Africa variant may be partially resistant, but I'm not convinced of that. But let's take the nightmare scenario that we do get a virus that is resistant to the vaccine. We can tweak it, and it probably would take maybe a couple of months, which of course we would not want to have to wait. But ideally, it is the kind of thing where we could tweak it and get a better version. But right now, all the evidence says the vaccine works quite effectively against all of these variants.
So I know the question people keep asking me is, when are we going to go back to normal? Do you have any sense of what we need to be doing with these vaccine rates to get us back to normal, to get us to that widespread immunity?
Yeah, absolutely. So we've got to just keep pushing ahead. Obviously, we had a bit of a botched rollout. I think it's picking up pace now, and we're getting to a point where we've got to be vaccinating literally millions of people every day. That would be the ideal. If we continue that pace, I do think late spring into summer, life will feel dramatically better. I don't know when we'll exactly hit the herd immunity threshold, but it will get much, much better as we get into later part of spring and certainly by summertime.
That is what I took away from that. Late spring and summer, there is light at the end of the tunnel. Dr. Jha, thank you so much for that encouraging word this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.